give the floor now to Christian Pascual, Mr. Christian Pascual, who's the president of the Barcelona Health Hub. Thank you.
Thank you, Pipo. And thank you very much for having you again, all of you again, here. It's great to see your faces. And I would like to also especially thank you, the authorities, Mr. Collboni, Mr. Junca. I really feel glad to see that we are aligned in the vision that we had back in 2018, that we saw that we have a great community and the opportunity to play a role on the global scale on digital health. And this is with the aim that we started all this project, and it has been really nice to see the evolution of it. And also, I would like to special thank you, São Paulo, because they have been supportive since the first day until today, and I think that we have a great journey together in the future also, to transform this place that it's a heritage to the future, to a showcase of the future of healthcare. So thank you, and well, I would like just to speak a few words on our vision on healthcare. And I have bad news to start. Our healthcare is broken and will be worse in the next few years. And I think that just because there's a rising healthcare demand, we have aging population, especially in Europe, that will be a problem. We have increase of chronic conditions that will demand much more on the health care systems. Also, we increase our healthcare expectations. We all want to play paddle at 80. So that is a problem because we need more surgery, more attention. And the population is growing. So demand will grow into an amount that it's greater than we can imagine today. But at the same time, we have one of the biggest pandemics in history of medicine, and it's the lack of physicians and nurses. McKinsey pointed this, and it's been in many predictions in the last few months, but we will have a huge lack of physicians. Just in Spain, 50% of the actual physicians will retire in the next 10 years. So imagine how is this colliding with the boomers like me, that we are the biggest amount of population right now. So this also goes together with the raising of the cost of healthcare. So we need to do something, and we will urgently need to do things. But we are here for this, and this is what we do every day. We try to build up with technology solutions that help us to sustain, scale, and even make a more inclusive healthcare for everyone. And not only here, in all the world, because imagine we are a privilege here, but in many places of the world, access to healthcare, it's a huge problem. And this is what we do. We need to transform patients and physicians with superpowers, with artificial intelligence. We need empowered patients, we need empowered physicians to do better, to do best, and to do even more safely. And with this technology, we need to do it, and we are all of us doing it. We really believe that the healthcare that we see today is just the tip of the iceberg on what will be the healthcare of tomorrow. I know that many of you have read that this week, Forbes released that Apple is they say they plan to launch an insurance coverage on the US by 2024 because they have the data that is collecting this machine right now to do it more efficiently than traditional insurance companies. Well, this is just something, but I really believe that today sick care, because what we do is treat people when it's sick, will evolve to healthcare, to treat people not to become sick. And needs to be a proactive health, not reactive, needs to be virtual, not only physical, omni-channel, personalized. It's huge, the change that is coming. And I know that many of you are working with all these changes to happen. IQVIA also presented a report lately that I like a lot because it's describing all the patient journey and pointing out all the points where technology can add value. They pointed 22 touch points. So imagine the impact that can we do with this change. And the investment is following, despite the lack of investment that we see these days because we have the, it's not the time to raise funds. It's difficult in most of industries, but in healthcare, it's still possible. We are on numbers above 2020, and not only these, Shifted just published the numbers for the first half of the year, and health tech, for the first time, it's the leading place where money goes in seed rounds. So despite the fallout in investment, healthcare is still there, and this means a lot. This means that what we see every day, what we feel, and I see a lot of faces here that know the game, there's a lot to be done on healthcare, and money will come. And Barcelona has a place, it's a place, and we will play a role in this shift in healthcare, not only here, worldwide. And to do that, and I'm now stepping a little bit on Luis' presentation, but we need an army. We need a huge, to leverage the knowledge that we have in the community to go for all the challenges that we have ahead. And we have great professionals as ambassadors that Luis has led this, let's say, recruitment of the army that will help us to bring this project further. Elena Torrente from DKV, she has been with us many years, Freddy Jordax, Ana Jané, Andrea Barbeiro, Javier De Oca, Francesca. We know a lot each other. We've been in many things in digital hair together. But also new people come in like Mara Larcón, Orlando Vergara, Elena Torras, Eduard Martín, Teres Llama, y Pedro Díaz. So it's not only us, it's all the community together that we plan to do great things here. And well, I just wanted to say thank you again, and please enjoy the summit. We made it for you. Thank you.
Thank you, Christian. There's really a lot of job to do, a lot of work to do, but you've got good people in the team, so this is going to be done.